Do you drink alone or in secret? Are you not able to limit how much alcohol you consume? Do you always feel an urge to drink? If you consume alcohol to cope with difficulties or to avoid feeling bad, you're in potentially dangerous territory. In this video we're going to dive deep into alcoholism from its stages to preventing it and its treatment, but before we get to the 4 stages of it, you should be familiar with what exactly is alcoholism. So let's begin. What is alcoholism? Alcoholism is the most severe form of alcohol abuse and is a condition in which a person has a desire or physical need to consume alcohol. It is also commonly referred to as alcohol use disorder. It occurs when you drink so much that your body eventually becomes dependent on or addicted to alcohol. When this happens, alcohol becomes the most important thing in your life. People with alcohol use disorder will continue to drink even when drinking causes negative consequences, like losing a job or destroying relationships with people they love. They may know that their alcohol use negatively affects their lives, but it's often not enough to make them stop drinking. It's not always easy to tell when your alcohol intake has crossed the line from moderate or social drinking to problem drinking. Drinking is so common in many cultures, and the effects vary so widely from person to person. It's not always easy to figure out if you have a drinking problem. Before we get to the stages of alcoholism, if you like useful informative videos, make sure to subscribe and turn on the bell so you get notified whenever we upload a new video. Stage 1. Occasional drinking. Drinking is primarily social at the beginning of this stage. However, as this stage progresses, drinking is used with increasingly greater frequency as a means for stress reduction. The major physiological characteristic of this phase is that the person begins to develop a tolerance for alcohol. This means that he or she can drink ever larger amounts of alcohol while still functioning. These drinkers may be new to different forms of alcohol and likely to test their limits. This experimental stage is commonly seen in young adults. Medline Plus characterizes binge drinking as, for men, 5 or more alcoholic beverages within 2 hours. For women, 4 or more alcoholic beverages within 2 hours. Ask yourself if you drink to make yourself feel better, or if you drink because the people around you are drinking and it is socially appropriate. If you are drinking manageable amounts in social settings, then you most likely do not need to be overly worried. However, if you are drinking to make yourself feel better, to avoid worrying, to forget bad memories, or to reduce anxiety, you may be in the pre-alcoholic stage. Stage 2. Drinking frequently. Drinkers leave the experimental stage when their alcohol consumption becomes more frequent. Instead of just drinking at parties once in a while, you may find yourself drinking every weekend. Blacking out from drinking too much is a warning sign of this stage. You may find yourself lying about drinking to friends or loved ones. You might also hide drinks, such as by spiking your soda or coffee, when no one else is around. Regular alcohol use is different from moderate drinking. There is usually a higher emotional attachment to it. A moderate drinker might pair a glass of wine with a meal, while a regular drinker uses alcohol to feel good in general. As increased drinking continues, you become more dependent on alcohol and start thinking obsessively about drinking. Then you are at risk of developing alcoholism. Stage 3. Problem drinking. Frequent, uncontrolled alcohol abuse eventually leads to problem drinking. However, any form of alcohol abuse is problematic. But the term problem drinker refers to someone who starts experiencing the impacts of their habit. In this stage, the symptoms of alcoholism usually become obvious to friends and family members. You may become more depressed, more anxious, or begin missing work and social obligations because of drinking or hangovers. You might drink at inappropriate times, such as when caring for your children, driving, or at work. You also may become increasingly irritable, arguing with your spouse or friends. Your body will begin to change because of alcohol abuse. You might start developing facial redness, stomach bloating, sluggishness, weight gain, or weight loss. Many drinkers at this stage are more likely to drink and drive or experience legal troubles as a result of their drinking. During this stage, you might make several attempts to stop drinking and even attend support groups. Support groups can be effective. Many who struggle with alcohol abuse are able to successfully control urges to drink with help, but denial is one of the biggest obstacles to getting help for alcohol abuse and alcoholism. The desire to drink is so strong that the mind finds many ways to rationalize drinking, even when the consequences are obvious. By keeping you from looking honestly at your behavior and its negative effects, denial also exacerbates alcohol-related problems with work, finances, and relationships. And that's when you've reached the fourth stage. Alcohol addiction. Drinking becomes an all-day affair, and everything in life, including family and friends, takes a backseat to drinking. Compulsive behaviors are prominent in addiction, and people with alcohol addiction often drink whenever and wherever they desire. If job loss has not already occurred, it frequently happens in this stage. At this stage, you no longer want to drink just for pleasure. Alcohol addiction is characterized by a physical and psychological need to drink. People with alcohol addiction physically crave the substance and are often inconsolable until they start drinking again. Serious health problems may develop, such as cirrhosis of the liver or dementia, memory loss, heart problems, diabetes, and so on. Consuming too much alcohol too quickly can slow your breathing and heart rate, lower your body temperature, and cause confusion, vomiting, seizures, unconsciousness, and even death, all because of alcohol poisoning. Paranoia is characteristic of this stage as well. Late-stage alcoholics might also become overly fearful and not be able to explain why. The deeper into the stages of alcoholism you enter, the tougher it is to quit drinking. Attempts to stop drinking may be characterized by tremors or hallucinations. But remember, there's still hope. Even the last stages of alcoholism can be helped with therapy, detoxification, and rehabilitation. So obviously no one wants to find themselves at the latest stages of alcoholism, and you might ask yourself, how can you prevent alcohol use disorder? You can prevent alcohol use disorder by limiting your alcohol intake. According to the National Institute on Alcohol Abuse and Alcoholism, women shouldn't drink more than 1 drink per day, and men shouldn't drink more than 2 drinks per day. If you notice any impacts of alcohol use disorder in your life, or you feel that you're becoming addicted to alcohol, go see your doctor or your therapist, or consider attending meetings in order to save yourself from the horrible days to come. But what if someone is already at the late stages of alcohol use disorder? What should they do? If they're ready to admit they have a drinking problem, they've already taken the first step. It takes tremendous strength and courage to face alcohol abuse and alcoholism. Reaching out for support is the second step. Whether they choose to go to rehab, rely on self-help programs, get therapy, or take a self-directed treatment approach, support is essential. Recovering from alcohol addiction is much easier when you have people you can lean on for encouragement, comfort, and guidance. Without support, it's easy to fall back into old patterns when the road gets tough. Although every individual will have their own recovery plan that's tailored to their specific needs, treatment generally follows a structure. Remember, it's never too late to take back what's already yours. We hope you enjoyed this video, and if you liked it, hit the like button. Also, don't forget to subscribe and turn on the post notification bell.